Hi again, everybody. I'm Dan Stiefel with Crystal Health Periodontics, and we're here to talk about the next and last phase of how periodontal disease begins to progress. This is where some permanent damages occur, and so this is a part to make sure that we not only pay attention to, but also that we try to stay away from. So, here we are back with our gingivitis or gum disease stage, again characterized by bleeding gum tissue, by deeper pocket depths in the range of 4 to 5 millimeters, and by plaque development. So now, if the plaque on the tooth, as we remember, stays too long, it turns into something called tartar. Tartar is very, very hard, and it's stuck in place, and it can't be removed with normal home instruments such as brushing or flossing or other instruments. Tartar does two things. It catches more food, and it protects that food from being cleaned. So the bacteria that live in our mouth begin to release toxins around that area. They begin to gobble that food up. They release toxins. They start to irritate the body even more, creating more of an inflammatory response. And then it can't be cleaned because the tartar is sitting on top of it, so that turns into more tartar, catches more food, and you can kind of see a bad pattern happening here when it comes to tartar development. Then it catches more food, turns into plaque, etc. So, again, that starts to release toxins further into the environment, and the body now has a decision to make. It's been trying to defend itself by sending a lot of blood to that area. However, it's important to understand that there is a limit to this, to the amount of defending that it will do before it starts to make some other decisions. So if it's defending itself, but it's losing the battle because toxins are coming closer to where the bone is, it will start to change the cells that it sends in the blood system to be able to actually make more room for these toxins to be released without getting into the bone. So the body actually starts to remove its own bone to make more space for this to occur. If it doesn't stop, the body will go ahead and remove more bone to make more space. And so now we have the presence of periodontal bone loss around the tooth, and the gums begin to proliferate pretty fast down the tooth structure, and so now we have periodontal disease. And this is characterized when we place our measuring stick into place. This would be characterized by much, much deeper probing depths, and the gum tissue proliferates down the tooth structure, and you can see how the bone has deteriorated. If this is allowed to continue, obviously there's a limit to how much bone loss can occur around the tooth before a tooth is lost, and this is how teeth are lost to periodontal bone loss. So in this third phase, this is considered periodontal disease, or periodontitis. This would be characterized by tartar development. The numbers here will be pretty deep, from the range of 6 to 15 or even higher millimeters. We typically would have bleeding, and there are times when we actually have pus, and that if there was pus that was present during our examination, we would call that a periodontal abscess. So, thanks for joining us again today. Have a great day.